Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I'll be talking about histrionic personality disorder. In this video, we'll first look at what histrionic personality disorder is. We'll then look at some statistics, risk factors and causes, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Histrionic personality disorder is a mental health condition characterized by patterns of exaggerated emotionality and attention-seeking behaviors. Histrionic means dramatic or theatrical. People with histrionic personality disorder rely on the approval of other people for their self-esteem. They often act dramatically or inappropriately to obtain attention. People with histrionic personality disorder are typically perceived as flirtatious, charming, manipulative, and impulsive. Histrionic personality disorder often co-occurs with borderline personality disorder, narcissistic personality disorder, dependent personality disorder, eating disorders, and substance use disorders. Statistics. In the United States, histrionic personality disorder affects 2% to 3% of the general population. Women are 4 times more likely to have histrionic personality disorder than men, although women may be overdiagnosed, while men may be underdiagnosed, as many do not report their symptoms. Risk factors and causes. Histrionic personality disorder typically begins in the late teenage years or early 20s. Histrionic personality disorder is a result of the following factors. Genetics. Parents with histrionic personality disorder can pass this disorder to their children. Childhood trauma, such as a death of a loved one. Childhood abuse, such as verbal abuse. Parenting styles, such as parenting styles with no boundaries, or styles that are overindulgent, or parenting styles that are dramatic, inconsistent, or exhibit sexual behaviors. Symptoms. A person with histrionic personality disorder can display some of the following behavioral characteristics. Frequently seeks attention, feels discomfort when they are not the center of attention, exhibits seductive or provocative behaviors, flirts and charms, manipulates other people, has shallow emotions that change quickly, attempts to gain attention with physical appearance, uses vague speech that is deficient in detail, exhibits dramatic behaviors with excessive emotions, is gullible and easily influenced by other people, and perceives relationships with other people to be more intimate than actuality. Effects. A person with histrionic personality disorder can have a higher risk of developing the following: depression, substance use disorder, somatization disorder, panic attacks, conversion disorders, and suicidal ideation. Treatment. Psychotherapy is a commonly used treatment for histrionic personality disorder. According to a study, 159 patients with histrionic personality disorder agreed that psychotherapy helped to decrease their symptoms and improve their relationships. A type of psychotherapy is cognitive behavioral therapy. This therapy helps a person with histrionic personality disorder address their disruptive thinking patterns. It can teach a person to think and behave more peacefully to reduce their volatile behaviors. Cognitive analytic therapy is another type of psychotherapy which addresses how a person thinks, feels, and behaves. Psychodynamic psychotherapy helps a person practice self-examination and self-reflection to understand the psychological source of their emotions. It can also help a person identify disruptive relationship patterns. Supportive psychotherapy focuses on improving self-esteem and symptoms through an examination of relationships and behavioral patterns. Lastly, group therapy can help a person understand their disorder through group discussions and seeing their own behaviors in other people. Coping strategies. There are a few ways to cope with histrionic personality disorder, such as developing consistent eating and sleeping schedules, exercising regularly, eating healthy, avoiding alcohol and drugs, and reaching out to family and friends to stay on track. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.